Hello, my name is Annette Bettridge, and over the past year, I integrated strategies into the PA curriculum to destigmatize mental health and address the current opioid epidemic. I did this with a focus on promoting responsive and respectful treatment to individuals who are experiencing substance use disorders and psychiatric disorders. I applied numerous different techniques, including context-based education, which is an evidence-based approach in which students have opportunities to interact face-to-face with individuals with lived experience in order to reduce stigma. So PA students went out into the clinical environment at Crossroads Substance Use Treatment Center and took histories and physicals, and after we do a focus group to discuss lessons learned and shifts in perspective. When the pandemic occurred, we had to move outside of the clinic, and so I brought individuals from Crossroads into the Zoom classroom to share their lived experience, as well as individuals from NAMI who came to share their lived experience with psychiatric disorders. Experiential learning activities were also integrated, learning by doing with reflection, and this was done through simulated patient encounters. We did role play activities, and then students had opportunities to reflect. We did communication drills, which were already established before I started, but I integrated a lot of the cases and added more levels and components of psychiatric illness. So students had opportunities in a telehealth scenario online by Zoom to interact with simulated patients and problem solve severe mental illness cases in which they were required to set boundaries centered around prescribing opioids. They addressed substance use disorder cases, used motivational interviewing strategies, and then they also were provided foundational knowledge through video and online modules, and the classroom was flipped. So the students could develop their own role play scenarios and problem solve, and then teach one another different communication strategies and problem solving using motivational interviewing and other counseling style techniques. Interprofessional education was done in the clinic, where students would work with nurses, nurse practitioners, and even do warm handoff to psychiatric services. When the pandemic occurred, we then shifted to Zoom learning and had opportunities for PA students to interact with PT students in order to problem solve and come up with strategies to address pain and addiction as a team to provide whole person healthcare. By the end of it, I was promoting active learning in an online forum to address the opioid epidemic, and all students were certified, MAT certified, so that when they graduated, they could prescribe opioid treatment to individuals experiencing opioid use disorders. They also got advanced communication skills training from Crisis Prevention Institute, verbal de-escalation skills and certification. It took numerous people to contribute to the curriculum. I had guest lecturers from SOMA, from Diversity and Inclusion Department, from Banner Chaplain, to talk about spirituality and medicine, mindfulness, self-care, cultural responsiveness, health literacy, social determinants of health, among other topics. It cost approximately $5,000 for the training, and that was focused primarily on the verbal de-escalation training. This curriculum could be implemented on a tight budget. Once a trainer is established, they can continue to train future generations of students in the additional verbal de-escalation training. Overall, the students were impacted because I did a causal comparative study comparing one cohort of students who did not receive the curriculum that were new PA students compared to PA students who did receive the curriculum. And there was a statistically significant shift in self-efficacy scores. This was also supported by the reflective writing assignments, where students shared that they felt increased levels of self-confidence in their communication skills and their treatment strategies, and increased confidence in working in interprofessional teams. So the innovation aligns with all 5 of the core professional attributes. I thank everyone who contributed to this curricular design, and I'm happy to share any of my thoughts and ideas with any other departments. And thank you very much for listening.